This video is on approach to fever. A fever is defined as a temperature greater than or equal to 38 C, or 100.4 Fahrenheit. I want to head off something at the beginning of this, because this is an approach to an elevated temperature. We get taught very early on that fever is infection, and that's how a lot of providers are going to think, and that was a really good outlook as a student. But now as an internist and an intern, no longer does fever equal infection. Instead, fever equals inflammation. And we're going to cover an approach to elevated temperature with a focus on inflammation. But this advanced organizer also lets you take into account things beyond inflammation. In the world, the sun shines. The first cause, or major category, of things that can cause an elevated temperature is the environment. Most houses have a cooling mechanism, such as the AC, the air conditioner. But the air conditioner only runs if it's hot out and the thermostat is set. This is the house method. Inside that house is the thermostat. And the thermostat is reset to a different set point by cytokines, inflammation. So let's start on the left and work our way back over. The environment is the heats, the heat strokes, heat exhaustion, heat exposure. And usually, internists don't see this. The ER takes care of that for us. Sports players play out in high heat. If the ambient temperature outside is higher than the body temperature, you can't lose heat to the environment, and therefore the environment will still heat into the patient. Generally treated with fluids and being taken out of the environment. This is a problem with people who don't have air conditioners, where it gets above 100 degrees. The AC is the cooling mechanism, and if it's dysfunctional or broken, that could cause the patient to generate too much heat, and it can't be cooled off. The advanced organizer for the second category is NMS, which is convenient because the first diagnosis is neuroleptic malignant syndrome. Look for antipsychotics. The M is malignant hyperthermia. Especially with halothane anesthetics. That's why we ask if you or anyone in your family had trouble with anesthesia. And S is serotonin syndrome. Antipsychotics, SSNRIs, anesthetics. And then the big one is the thermostat, because lots of things can cause inflammation. Yes, infection is on the list, but other things do it as well, such as clots, cancer, and autoimmune disease. The infections that people miss can be recalled by using AEIOU. Abscess, in particularly the intrahepatic abscess, endocarditis, indwelling catheters, to also remind you that if there is a fever and they have plastic, get the plastic out. Foley catheters, central lines. Osteo, because you can't see it, even though there's an infection underneath the soft tissue, and to round out the advanced organizer, UTI. Clots. Before we had CKMB and troponin I, people who were having an infarct were actually tracked using their temperature. So yes, clots can cause a temperature in the way of a DVT-PE, but also think of arterial thrombosis as well. MI, CVA, and acute limb ischemia. The cancers that cause fever are generally not going to be the solid organ ones. I think of them as, since it's the cells that cause inflammation are the white blood cells, I kind of think of this is how I keep them together. The cancers that are going to cause fever are going to be leukemia and lymphoma. An autoimmune disease generally doesn't have very high spiking temperatures, and they're going to have a history of it. So look for things like lupus, rheumatoid arthritis, and the seronegatives. Things that act like acute infections, like gout, the monoarticular arthropathies, can also present with a fever. And then these are the things that reset the thermostat. Then there are things that can cause problems with the thermostat, and that is the T's. A thalamic stroke, because the thalamus is the thermostat. Thyroid storm. And the meds. In particular, in the inpatient setting, penicillins like Piptazo. So this is an approach to how we can keep an open mind to fever, but what happens when you get the page? Now, with this on the board above me, you're going to say, well, maybe it's not going to be infection, but if you get a page, hey, there's an inpatient fever, you should treat it like an infection. So the knee-jerk reactions, if to an inpatient fever, if it's new, you don't have to do this every time, is to get blood cultures, a urinalysis with urine micro, and a chest x-ray, looking for pneumonia, UTI, and a bloodstream infection. But then with this in mind, you can actually just walk up to the patient because you've already got these ordered on your way up, and then you can start to think. Because more than an infection could be causing that person's elevated temperature. And that is the approach to fever.